Hello, this is Dr. Rafi Romano. Today I want to give you a really useful tool to do direct bonding. I don't do direct bonding in every case. I actually hardly do direct bonding because as you know, or you should know, the lingual surface is not only hidden inside the mouth, but it also has a very, very complicated architecture. And if you want to place the bracket precisely according to the long axis and in the middle of the tooth, you better look carefully on a plaster model. But many times, you know, you have debonding of brackets, like in this case, you can see the two brackets were debonded, and we needed to rebond these brackets. So I will show you how I do a direct bonding in this case, how we bend the wire in an actual case, not, you know, theoretically, how I bend a new wire in the mouth, how I ligate it, or the procedure to continue the treatment. The learning objective is to learn the direct bonding technique, what are the problems and solutions, and what are the things we should pay attention to. So here you can see the patient in the clinical situation. I put phosphoric acid on the posterior side of the teeth, of course after I cleaned it properly. We properly do the rinsing, drying like in every case. In the upper arch, everything is quite simple. We get a very nice dry field very easily. We put primer on the lingual side carefully. I try after cleaning not to clean all the previous composites in order not to damage the enamel too much. Then I locate the bracket carefully with my pincette. And with Explorer, I take out the excess of the composite. Still, you can see the bracket is still moving. Then I use my hand mirror and I locate the bracket and I try to compare it to the neighboring teeth. And only when I see that the lengths, the axis, everything is okay, only then I do the light cure. I do the same procedure for the second tooth. Again, using my mirror. In the mirror, you sometimes see even better when you look directly because you can see both of them from the upper and see that you are locating in the perfect location. Perfect, of course, it's always we will have some mistakes that need to be corrected with wire bending. Now I take a CNA 016 wire, which was the wire because he was in the middle of treatment. And you can see that the location of the slots is quite good because I don't need, I have the front area goes into the slot nicely. Now I mark with my plier where I want to do the mushroom bend. You can go back to the wire bending lecture and see how we make this bend. So this is the mushroom bend, passive bend in the arch wire to fit the shape of the arch, done usually between cuspid and premolar. I hold the wire in the place and then I do a mark for the second bend. Now I do the second bend. And my wire is ready to use in the mouth. I locate it nicely in the slots. And now in this case, I decided to put back the power chain that he had before in order to close the spaces. Now I take in this case a very wide power chain, not condensed, because the spaces are still very big. And I go slowly from side to side, putting from the hook on the molar slowly all over the teeth, around the jaw bracket, as you can see in this demonstration. You can see that although the brackets are very small, it is very easy to put the chain on the wings. The wings have undercuts where I can put the elastic chain very easily. You can see this was not shortened in any way. This is a live presentation. This is exactly how much time took to put the wire, the brackets and everything. All this is a truly uncut video. Now, the excess of the wire, I try to cut with a burr, because if you try a distal cutter close to the tube, you can have the tube in your hand. So I cut the excess of the wire to put it flush with a burr, and then I look to see everything is okay, and patient is back into treatment in around 10-minute procedure. Of course, if you have more questions about the biomechanic, about the shape of the brackets, about the features of the bracket, go back to see one of the previous 7 movies we have done on the jaw bracket. In summary, we have learned in this specific movie that indirect is always better than direct. It's more precise, it's more easy. And always compare, if you bond separate brackets, compare them to the neighboring one, take photos, and assess if you put the bracket in the right position. Then write in the patient chart which brackets you have bonded directly. So if teeth are moving in a wrong direction and these brackets are the one that you have bonded directly, these are the one to rebond. I thank you very much, and you are welcome to see more videos that I have in my own YouTube channel on many topics in orthodontics and in aesthetic dentistry. Thank you very much. Bye-bye.